Short term, we're saying, all right, we've got thousands of patients potentially without care immediately beginning the first of the year. This is in many ways an emergency situation for those folks that need that care.
A health care provider shuts its doors, leaving thousands of patients scrambling to find new doctors. Good evening, everyone. The numbers, according to the Cincinnati Health Department, are staggering. 14,000 adults, 12,000 children, patients of the now out-of-business Neighborhood Healthcare Incorporated.
That agency did not get a federal grant that was needed to stay open. Local 12 News reporter Jeff Hirsh joins us from one of the agency's former clinics in Walnut Hills with what happens next. Jeff.
Yeah, well, what happens next is the various levels of government, local, state, and federal are going to get together with insurance carriers and come up with a plan so that the people who are patients of the facility behind me, like this one and the other ones, of neighborhood health care, get the neighborhood health care they need when they need it. The sign at the Walnut Hills Clinic of Neighborhood Health Care Incorporated says accepting new patients. Not true. At this office and the others downtown in Norwood and Harrison, they're not even accepting their own patients anymore.
The problem is the facility is closing down, and we don't have a doctor.
Here at the door to the Harrison facility, you take a look, it says 12 to 1, you figure, that's lunch, that's okay. Then you look here, closed 12:24 and 12:25, that's logical, that's Christmas. But Neighborhood Health Care Inc. will officially be closing on 12/30/2013. That's today, that's closing for good. Makes lunch seem kind of, not really that significant. Thousands of patients are impacted, like Linda Hunley of Harrison. Hunley and her two autistic granddaughters now have to find new clinics and new doctors. Hunley figures she'll deal with it okay. The granddaughters ages 7 and 9, she's not so sure.
They don't deal with changes too good at all. They're used to routine, and if you interrupt their routine, then you got problems.
This is a very challenging development that's happened in terms of the healthcare safety network in the city.
Many of Neighborhood Health Care's clients are low income and uninsured. The City Health Department, their clinics remain open. They'll make slots available immediately for OB patients, and other hospitals will open slots for other appointments soon. The goal? Find people primary care physicians.
Is a system that's much more expensive and much less efficient to treat in the emergency room. Everybody agrees about that.
Short term, the health department and hospitals will serve patients. Long term, the hope is to find a new provider to take over Neighborhood Health Care's facilities, or at least their patients.
I don't know. It took a long time for my daughter to find this place.
Now, the state expects to have a hotline set up very soon, so folks who have gone to these facilities will be able to call and either line up another place to go or perhaps start signing up with another insurance carrier. Live in Walnut Hills, Jeff Hirsh, Local 12 News.
Okay, thank you, Jeff. Neighborhood Healthcare Incorporated also operated the 6 clinics inside Cincinnati Public School buildings. Now, 2 of those clinics are closing permanently. The health department's taking over 1, and plans are being made for Children's Hospital to run the other 3.